Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions to make a better system for all of us. Today we're going to talk about culture and healthcare. Before we do, I want to point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter, which is the text for today's video. In that newsletter, we will have links to all of the stories, history, background material, studies, actions, everything is in there. Subscribe for free because this is my retirement job and I don't take money for it. Okay, let's get started. I first want to talk about medical debt. It is a huge problem in the United States because medical training just costs a fortune, unlike other countries. However, a generous donation was made in the past few days to a healthcare system that's helping to turn the tide for about 120 people. It's called Black Family Philanthropies. It's a charity, and it has a history of donating millions of dollars to healthcare in New York. They just gave $5 million to pay off student debts for 122 staffers in behavioral health at New York City Health and Hospitals. You can find a link to that story in the newsletter. Let's now talk about states that have the best health care. That's a complicated subject because it's a private and public venture. Minnesota's healthcare system has long been recognized as one of the best in the country, and a recent study reinforced that viewpoint. According to a WalletHub study, Minnesota's healthcare system is #1 in the country, followed by Rhode Island and South Dakota. The study compared all 50 states in the District of Columbia across 3 key dimensions: cost, access, and outcome. Minnesota also has one of the best public hospital systems, #6, and life expectancy rate, #5. The study also notes that the state's extremely low maternal mortality rate and relatively quick wait times at the emergency room played into their results. Let me point out what the wait time is in the emergency room. Get this, 16 minutes on average. I have friends who've waited 12 hours. Okay, anyway, Mississippi, here's a big surprise, worst in the country for healthcare, followed close second by Alabama and then West Virginia. Let's talk about a culture shift and patients, because when the culture changes for the better, patients benefit. We have previously reported that there is a huge cultural bias against people of color when it comes to pain management. This has been documented over and over again. Studies have found that many in the medical field believe that Black people feel less pain and so are not prescribed sufficient medication. There are wide numbers of studies on it. Here's one. I think I listed it at National Institute of Health. It's actually, I think, the National Institute of Health Medical Library. Anyway, that link is in the newsletter. Black and Hispanic emergency department patients are also less likely to receive opioids for pain than white patients who have exactly the same elevated blood pressure or heart rate, according to a study that was released this month by Epic Research. And of course, that link is in the newsletter. Our culture has inherent bias that harms patients. Now, some have chosen to address that bias to benefit the patients. 7 states, California, Michigan, Maryland, Minnesota, New Jersey, Delaware, and Washington, have actually enacted laws requiring some level of implicit bias training for providers or medical students. California's law, even better, mandates that implicit bias training courses have to be taken by nursing students. Even better, Maryland, every health professional has to have such training regularly in order to renew their license. Now, one 2019 study by Indiana University found that physician residents and fellows had lower odds of demonstrating treatment bias against Black patients with chronic pain after receiving an implicit bias intervention. So they were trained and then they were tested. The intervention gave the providers personalized feedback on their biases, as well as broader perspectives on how pain impacts Black individuals' lives using videos and a virtual patient simulator. You want to think, where does AI matter? My God. Okay, sorry. Efforts to teach students and professionals about how to provide adequate care for patients of different backgrounds are instrumental in ensuring that they don't go on to treat people of color differently when managing pain or any other condition. This was actually in Modern Healthcare, and of course the link is in the newsletter. So this is a good story. The medical profession recognizes that there's a cultural issue. They start addressing it by educating people, and they change generations of providers coming forward, and it benefits the patients. All good news. Let's talk about reproductive rights and culture. We've taken actions from this newsletter and these videos over and over and over again, asking Congress to get in gear and restore the national right to choose by passing the Women's Health Protection Act. In case you're interested in Congress, it's Senate Bill 701 or House Resolution 12. You just make a note of those. And guess what? We're going to do that again today. But before we do, I want to introduce you to somebody special. Her name is Dr. Leila Houshmand. She has a doctorate. She works in the medical world as a scientist. She was 8 weeks pregnant and her vision became blurred. Her ophthalmologist was not sure of the cause, but told her that investigation could damage the fetus. She left it right there. Now, securing an abortion to preserve her vision took significant time, as her regular doctor and the medical facility where she ordinarily goes were not interested in helping her. Like, even though abortion is legal where she lives, they were not interested in getting her an abortion to save her vision. She's only 8 weeks pregnant. The delays that she incurred securing the abortion actually allowed a virus that was affecting her optic nerve to spread. She has permanently lost vision in that eye. Her pregnancy suppressed her immune system, which is typical, and allowed the viral infection to spread. Now, the real problem is that her medical professionals were focused on balancing fetal health and her health instead of focusing on the patient sitting right in front of them. Dr. Houshmand. This is the result of years of cultural harping on the rights of fetuses, and that discussion winds up ignoring the woman. It does not help that there are exceptions to abortion bans for maternal health if they are vague and if doctors are frightened to act. Our culture has actually shifted to such a point that the woman does not come first. I include some links to her stories. The first one actually she wrote. The second was an interview with her, and you can go and read those. So what fixes this? Well, passing the Women's Health Protection Act, that's a good thing, because then abortion would at least be available legally in all 50 states and the District of Columbia. But a second is that a cultural shift is needed that focuses on maternal health. Just as doctors can be trained to remove color bias, they can be trained to focus on the women in front of them. So let's take that action. Let's remind our member of Congress and senators that we still do not have the Women's Health Protection Act passed. Let's let them know that implicit bias damages women, as with Dr. Houshmand, and you can reach them. I have a link. It's www.usa.gov/elected-officials, but I'll put that in the YouTube description box. Or you can get in contact with them my favorite way. Use ResistBot on your cell phone. All you have to do is send a text message to 50409. Here's the message you'll send. Super simple. Sign, SIGN, space, PKTWTG. That's sign, PKTWTG. And I'll just read you the email that your two senators and your member of Congress will get. I'm your constituent, and I want you to know that it's time for you to get the Women's Health Protection Act up for a vote. It's Senate Bill 701 or HR 12. Women are being abused and treated as second-class citizens without bodily autonomy, and that's disgraceful. Think of discharge petitions, rules of suspension, something, but get this going. Lives are at risk, and you're the only cavalry that can come to the rescue. I want you to know that our culture has shifted in the last 50 years. When a pregnant person presents to a doctor with a serious health concern, her health and rights are not always the doctor's first concern, as they should be. Delaying treatment while considering the fetus can be deadly for the woman. Here, you can read about Dr. Leila Hushmand, who lost her sight in one eye due to that kind of delay. And I have a link to the story that she wrote. It'll be in the email. You can help repair this too by demanding that medical and nursing schools who receive federal funding train students in treating women first. This kind of training has been shown to work in overcoming the inherent bias treating people of color differently with respect to pain management, and it will work here too. Get on it. There is no reason to force women to suffer needlessly. Thank you. That's what I've got for you today. Take the action down below, like, share, subscribe. Go subscribe to Healthcare Advocacy's newsletter. Have it delivered to your inbox every day. You can also leave me a comment, suggest research topics, or get in touch with me at healthcareadvocacy1, it's all one word, @gmail.com. Have a good day.